So there are a variety of scars that people can present with, ranging from that nice flat, white, not tight, flat line scar. You can get a hypertrophic scar where the body has produced too much excess collagen on top of the scar. And then you can get that keloid scar where the body has produced too much collagen over the scar and then beyond the scar borders. Now, the LymphaTouch machine is great on scars that are pinned in, that are tight. The client might report that overhang over the top, and the LymphaTouch device can get into the scar under that overhang to gently release that scar out. So it's great on hypertrophic scars as well, where you want to really soften that scar in a really gentle way. I wouldn't necessarily use it over keloids. I'd be careful as I was using it over that. As we know, the gold standard and international scar guidelines state that silicone plus compression is really advantageous for keloid scars. So always refer to your code of practice, obviously the clinical guidelines and the guidelines that PhysiQuip and LymphaTouch set out about using the device. But the LymphaTouch is great on those hypertrophic, those tight and those pinned in raised scars. So I would use LymphaTouch on scars that are 6 weeks plus post that surgical procedure. You want the scar to be fully closed, no infection, healed over, and also that the client is ready to engage with using a medical device on that scar. You would never use a device straight away. You'd make sure you fully assess the scar first of all, work within your scope of practice. You might want to use hands-on treatment techniques first of all to help the client engage with the scar, and then start using the LymphaTouch device as an adjunct to your hands-on therapy, and also overall advice for that scar and that client. You would never use the LymphaTouch on an open wound, a wound that's weeping, a wound that possibly has a scar that has infection, and of course somebody that you know that might have active cancer diagnosis as well. So the LymphaTouch device works on those post-surgery scars that are really deep, that have gone through all the layers of the tissue, that are tight and pinned in. Those surface level, small incision scars may not respond as well because they haven't been tight, they haven't been pulled through those layers, and those fascial connections aren't as tight underneath the skin. The LymphaTouch doesn't work on scars such as stretch marks. And what are stretch marks? Well, within your body in the fascial connections, your fat cells are stored within the housing of that fascial connection, and they can expand and expand and expand as your body expands. And of course, that's the scarring from that fat cell that has expanded in such a way. So the LymphaTouch device is not going to make an effect on those kind of really surface level scars.